Hello and welcome back to another episode of Health Yes, here at Cameron County Public Health, where we talk about all things public health and more. Joining me at the table is our very own Public Health Administrator, Mrs. Esmeralda Guajardo, and today we're here to talk about public health with our very special guests, Regional Medical Director, Dr. Emilie Prot, and Assistant Regional Director, Ms. Sylvia Hobbs. Welcome to the show.
Thank you.
Thank you.
So tell us a little bit about yourself, the type of work that you do for Region 11, and how it is associated with public health.
So I work for Public Health Region 11. I consider myself an administrator. So there are several programs. There are community-based programs, community outreach programs. There's the clinical side of the house, and then there's the other. So Dr. Pro takes the clinical side of the house and does all of the communicable disease and that sort of work. And I do all of the administrative side of the house, the operations, and I manage some of the programs that are community-based.
Good afternoon.
Good afternoon.
My name is Emilie Prot. I'm the Regional Medical Director for Public Health Region 11. And I am trained in preventive medicine public health, have gone through medical school, and after that did residency with an internal medicine residency, and then my residency at DSHS in public health. And after that, I started my position in 2017, and that led me here. So that's how I'm with public health. So my main role is to create relationships within the region, not only with our local health department partners, but others, maybe non-governmental organizations. And we work together on different aspects. And the main thing is to get a good story of what's going on and understand everything that the community is going through, or some of the specific needs that are needed to improve the health. And we advocate for that in Austin. And on the medical side, I still see patients in tuberculosis, Hansen's disease, which is leprosy. I help out our nurses who are doing immunizations out in the community, and also our HIV/STD program. They'll see patients who aren't connected to care, and who, if we have a positive syphilis patient, they'll go out and do some outreach. And so they'll usually let me know which patient that is and what the requirements are, if she's pregnant or not. So I'll give the okay for that.
And in speaking of partnerships and relationships, I like to pass the verbal torch over to Ms. Guajardo. Can you tell us a little bit about your partnerships with and your relationships with our two guests?
Well, I'm the health administrator here for Cameron County Public Health, and actually prior to coming here, I used to work at the state health department, and so working tuberculosis back in the day. And so actually I knew Mrs. Hobbs from back then. And then of course in my line of duty, I work with, I got to meet Dr. Pro here. So that's how I actually work with them. But I can say that outside of that too, they have a pretty good sense of humor. So we tend to share jokes here and there about things, all things public health.
Of course.
And so,
it definitely makes it easier to work with when you have a lightheartedness of, that sort of relationship with each other.
They're good people to go to when you need a little good laugh about something. So, yeah. But I think for the listeners that don't know this, public health also works almost like DPS and the sheriff, county sheriff, and FBI. So, CDC and public health level, CDC is at the federal level. DSHS, the state health department, is at for DPS, and then Cameron County would be like where the sheriff's. So I guess I'm the sheriff here for public health.
Of course. I mean, you mentioned COVID briefly, but I mean, obviously during the pandemic, all eyes were on us too, with especially yourself, what decision makings or how to navigate the pandemic as well. There was a lot of eyes on us too. So
we have PTSD.
I think as long as I've been in public health, one of the main issues that we've had is communicating to others and getting communities and people in leadership to understand what we do. And I think that COVID really helped to clear up that picture of what we do in the way of managing a disease and doing surveillance and managing.
I would say at the beginning, there was a lot of uncertainty. We thought, okay, we can see things that are happening abroad, and we didn't know how we would be affected. And originally, when we had to make the decision to start sending people home, we thought, oh, it might just be for during the duration of spring break or maybe 2 weeks. And we started seeing more and more cases. We had to quickly increase our manpower because we don't have a lot of epidemiologists. And even epidemiologists, people didn't even know how to pronounce that.
Right.
On the news, people were struggling, and now they understood, and it started becoming a more trendy career. And it was in the light of everything. And really, it's understanding how diseases are spread and how we can make sure that looking at the disease process and how it's incubated in a person's body, how long that person can remain infectious. And before vaccines, we needed to have a longer time period. And with vaccines, we were able to shorten that period. And so we saw how we were able to change some of the rules or some of the policies that are out to help us with making sure that diseases don't spread across communities, and we're still able to work and go to school and other things. Of course, we've had to go through a lot with everything. And that's when public health would recommend to those who can make decisions at the local level, state level, to put in policies or recommendations for that. But I think we all work together, and I'm proud of the border local health departments that had a lot of experience in standing up quickly for clinics and would work tirelessly. I think all the staff in public health are very flexible in the way that they do things, and they're able to take on a new role and step up to the plate.
What's a good point to make is that while I cover one county, Dr. Pro and Mrs. Hobbs cover a lot of counties from Laredo across to Corpus down for those counties that do not have a health department. So while I feel like I had a lot of work, I can't imagine spreading yourself that thin to cover all these other areas, and working with the different politicians, a county judge, different judges, commissioners for each county. And so that in itself must have been pretty challenging.
Right. Doctor, you mentioned the terminologies that were kind of, talked about, epidemiologists and all these terms that kind of came about too. I myself, as someone who, I'm not a medical professional or anything like that, but I, of course, work with them side by side with them. I feel like I've learned so much. There's a lot of people that work here that don't necessarily work in the field, but have heard so much medical terminology during the pandemic that we almost feel like we're experts too. Like really. I remember.
You wear that shirt for a reason.
Of course.
With our logo. Yeah.
Because I remember when policies and I guess guidelines for dealing with not just the pandemic, but any outbreak, would come my way as far as creating something visual for the public to understand. I right away already know what these terminologies mean and how to incorporate them already, because I spent 2 years deciphering all these terminologies and how to associate them so that they're a lot more easier to understand for the public, which is part of the work that I do here. And so what drew you both to gain interest in public health and to start working with public health, and what led you down the career path that you have now?
Well, I was a hospital administrator, right out of college. The hours were brutal. Most days I worked 16-hour days. And I had a young daughter, at that age where I felt like she needed me. So I started looking for something different, I had worked for an AHEC for a while, and through the AHEC, we had a relationship with, it was then Public Health Region 8. Now we're Region 11, but it was Region 8. And they had this position open, and I thought, well, I'll apply. They kept saying, well, it's, it's not like hospital administration. It'll be a little bit, the pace will be a little bit better, and 8 to 5 Monday through Friday. So I said I'll jump on that, and that's how I got started.
All right, doctor.
In medical school, I remember really liking global health. And I always wanted to do some type of medical mission abroad. There was a faculty member, she was a ER physician, and she would always take students over to Congo. And I really wanted to go. And then my dad was like, well, if something happens to you, I'm not going to go get you.
So go to the valley.
I was really disappointed because I had worked with trying to help her raise funds and learning about practicing, or just learning about how she practices in a underserved area and all the needs that they had. Then I started a medical Spanish class, even though I can pull my own, I can communicate. But I started a medical Spanish class for students who are interested, just an interest group. And so we were a few, and we would go over terms. So like, all right, well, now we're going to do GI. And so we'd learn all the words, all the vocabulary words together, and we would practice just small little scripts so we could know just basics. And then I did it was called Medical Student Association, so AMSA. And through AMSA, I was part of the global health group, and we were able to do 1 month abroad if we were able to find, they do pairings where medical schools all across the country and the world are able to pair, and you can do an exchange. So we were able to get an exchange with my medical school, and I went 1 month in Mexico, in Guanajuato, in Guadalajara. So I was there for a month, and I really enjoyed it. And then when I started internal medicine, I continued. There was a strong Indian American faculty presence, and they would always go to India to give back to their community. So I went with them as well for a month. And I initially wanted to go into physical medicine rehabilitation, so post-stroke or accidents, and I didn't match into that specialty. So I was like, shoot, what am I going to do? And I saw that there was preventive medicine and public health, and I had always thought I would do a master's in public health, but I didn't want to stop school to take a year or a year and a half to do that. And I thought, okay, let me apply and let's see. And that's why I ended up in Austin for a couple years. And I remember applying, going through the first round of interviews and thinking, I'm not sure if I'm going to get this position or not. And I had to get the blessing. I remember coming down and meeting all the health department directors. I think we're in Falfurrias. I believe we're in Falfurrias. We all met. So there was Corpus, Hidalgo, and Cameron, and then my current boss, David Gruber. So we all met, and he wanted to introduce me to all of them. And Esmer was sitting right next to me. Eddie comes in with a box of donuts, and I was like, wow, okay, great. So it was in the morning. And then Annette Rodriguez was the health department director for Corpus. And we had about a 2-hour meeting, and David Gruber was introducing us. And the first thing Esmer said was like, you're not going to make all of us happy, right? And that always stuck with me. And then Annette, mid-meeting, was starting to she lifted books and she started doing some weights. She was always into fitness. And so I sort of gathered a sense of who my partners were going to be. And everyone has a different personality. And I learned how to work with all of them. All of their hearts are there in public health. And I think that sort of set the tone. And then the other introduction I had was I came down to Region 11, and David Gruber introduced me to Ms. Hobbs and Dr. Tyler, and he needed their blessing before he moved forward with the interview process. And so I was a little worried, but, I'm going to go in and introduce myself. And afterwards, he had a meeting in closed door with both of them, and we came out, and on the drive back, he told me, you got their blessing. So I was like, all right, So that's how I ended up in Region 11, and I haven't left. So I really enjoy what I do. There's always something new. Sometimes Cameron County calls me at 4 p.m.
on Fridays.
Duty calls. Wow.
That's interesting story, right?
Yeah, of course.
How did you end up here?
I was gonna ask you too.
But I just wanted to comment on what she said about how you're not always gonna make everyone happy.
You're gonna clarify that?
Yeah. Because I truly believe in that. And actually, every year we have a staff meeting with my program directors, with the entire staff. And so my little presentation this year was about what things I learned this past year. And one of them was that you'll never make everyone happy, but then there's some people, I've always known that, right? Obviously, but what I added to it was, but there are some people who are never going to be happy. And so you have to learn to distinguish the two, because then you're going to be miserable trying to.
That is very true.
To work with those people that just choose to not be happy.
Yeah, sometimes you can't get a mule to move when they're stubborn, and
Yep.
You gotta work with the people who are willing to work with you.
Mm-hmm.
Absolutely.
And so that's interesting. I'm glad I had some words of wisdom for you there. Yeah, and so how did I get started in public health? You know what? Actually, I came down to, because my family's from here originally, from Westlake. I'm from Westlake original, but I lived in Austin because I went to school over there, right? And I came down after I graduated, and I came to spend some time with my family, and then my family was like, "Why don't you apply for a job here?" And I thought, let me try it. Why not? So I did, and I had actually a few offers, but I applied for the state working as a child care licensing representative, inspecting daycare centers, right? Mm-hmm. And I chose that one for one reason, and that was that it's a state. I can probably move back to Austin, do a transfer. And I said, you know what, I'll stick with the state. But I was there for about a year and a half, and then I saw the posting for the TB program manager, or it was actually binational project coordinator for DSHS in Harlingen. At the time, I was working in FAR, and I got it. I really liked it up until there was one point where part of that job, I go to Mexico, and I had we had workers from Mexico.
You speak Spanish?
I do, but it's very broken. But
Un poquito.
Yeah. I should have started Rosetta Stone like you were trying to do over there with your sentences with them. But they would talk to me, the employees, the community health workers that we had in Mexico back then, and they would tell me, if there's an accident, you just keep going. You keep going. You don't stop, because here you're guilty till proven innocent. And I thought, geez. And then one day I was like, but anyway, but my mom would always worry about me being in Mexico and still traveling Mexico. It's a different country. And then one day, after talking to those community health workers, I remember I went to administration at Region 11, and I asked, if something happens to me in Mexico, who's going to be in line to get me out, you or my parents? And they said, please pause. And it was Mrs. Hobbs and Dina Sosa at the time. We'll get back to you on that one. And so the next thing I knew, they pretty much halted travel to Mexico until they could figure it out. And so I was there, but I think I kind of felt like we're not, and I completely understood, right, where the state was coming from, but I just felt like I wasn't doing a whole lot as productive as I wanted to. And that's when I said, let me start looking. And then as the assistant health administrator position for Cameron County opened up, and 25 years later, I'm here.
I remember very, very distinctly that meeting that we had in my office. And Ms. Guajardo was, just very concerned. Mm-hmm. I mean, what is going to happen if something happens to me? Mm-hmm. So I remember, and then shortly after, I remember her coming and saying she was going to take a job somewhere else. Well, it was hard because she couldn't do her work. Mm-hmm.
Yep. So I ended up, and I like public health. I mean, it was different from being the assistant to being the administrator. I mean, granted, it seems like, and and I tell everyone the story. The funny part before I became the health administrator, I made like my list of pros and cons of why should I not. I had one con, and that was working with the media. I was like, golly, I don't like that stuff, right? Uh-huh. I mean, how long have I been here? And you guys create a podcast, and I don't even want to be on this thing. I'm not that person, but I thought, what are the odds I'll have to deal with the media that often? Right. Oh my goodness.
And boy.
Dog seizures, Zika, COVID. I'm just like, Yeah, so
There's a camera everywhere.
yeah, but here we are. But I like it because it's something different every day.
Well, it seems like we've all had very much a very like humble beginning-esque sort of way of getting into where we are now, with seeing a position or an opportunity, come to us and taking it and seeing what happens. And seeing where you are now, what does public health mean to you and your position, and what sort of messaging would you like to bring across as as doctor, as administrator? What does public health mean to you?
I think that over the years, and we were talking a little earlier about how things have evolved. They're now more focused on being able to respond to a public health emergency.
Right.
We're still focused on healthy communities, disease, and surveillance, but the focus was more community-based, more environmental issues. We've moved somewhat away from that. Not to say that the work that we're doing now isn't very critical, but we have evolved quite a bit. And so the disease surveillance, the emergency response, public health response focus is very strong now.
From a physician's point of view, I would really put public health as the link or that space between a clinic and the community. And so you really have someone who, for example, as Ms. Hobbs was mentioning, you want to prevent them from getting sick to going to that clinic.
Right.
Or you want to make sure that they're equipped with some of the skills or things needed in order to show up and say, you know what, I'm 45 and I need a colonoscopy because I know that these are all the screenings that are needed.
Right.
So just informing people of how to be healthy and how to prevent illness. Or it's because maybe the physician and their team don't have the time to educate them on specific things because they're very busy and they have to see 20 patients a day. So they only have 12 minutes per patient. So I think we're really in that gap right there where we focus on immunizations, which is primary prevention. We focus on outreach, but we're also that safety net where if someone doesn't have anywhere else to go, we'll be able to help them navigate, in a sense, that the care that they need. But we're a big proponent of education, and I think that's where our strengths lie, where we know how to communicate specific things, like exactly what you're saying, how to break down complicated words and make them understandable for everyone.
Right.
So if it's grandma, if it's the child, and the child can speak to grandma, and because they saw this, and it can bring up specific conversations around health. And I think that's where public health really relies, and we're here to be a service to everyone.
I agree about how it's come a long way, public health. I do think that what I've seen is there's been a big transition to education. And I don't know whether that's because of COVID or finally people notice or finally people realize there's an agency behind all this that needs financial support or resources to be able to do our job. But, and I think COVID I think people understood now that if they're educated, they'll know what to do. Not necessarily us telling them what to do. They have to be educated first and then they're going to do the right thing. You hope, right, that they're going to do that. But I think public health has come a long way in terms of communications and community engagement. But I think now there's a term to it, community health workers. And so it's advancing, it's evolving, and I just think it's going to be hopefully that the added component now is technology. And I think the fact is the communications and education, it has to come so much faster than what we used to be able to put together before. Here we'll create a flyer for you and send it out. And now it's like, hey, someone gets a message, first case of something, and people want to know, what is it? What do what do we do to protect ourselves? And so we always have to, instead of being reactive, now we have to start being proactive. And I think that's probably one of the good things of public health if you have to look at the silver lining of COVID, that's it, is that we need to be more reactive, and people realize it, that they know that if we're not giving them the information they need, the education up front, it's because we don't have the means to do it. So someone support us so that we can do it. So I think we've been able to make public health more interesting, I think, with COVID.
Absolutely.
You know, I mean, like you said, that you know the terminology now, because as a computer graphic artist, you have to translate that graphically speaking, right? So that people can understand it. But I think, I think that it's going to be something that we're going to have to do. But, you know, I think a lot of it, you're only as good as your leaders, like what I'm talking about is my commissioner's court and my county judge, that they're able to support us in our messaging, which we do. I mean, I'm very fortunate I get that support from the current commission, you know. But because if they weren't able to allow me, or if I wasn't able to do this because they're not allowing me, then how effective are we?
Exactly.
You know, and so they need to be able to say, okay, we trust public health. Go do your job, you know, between myself and Dr. Castillo, our health authority, right? But then Dr. Prot too, when Dr. Castillo's out, she'll step in for Dr. Castillo. And so they already know, and I think COVID was also, that's another good thing about it. They got to know us a lot better, probably a lot better than they ever wanted to know me, you know, and Dr. Castillo, but they've already know how we think and how we work. And I think they've started to trust us a little. No, I mean, I think they do trust us. And so I think that's always a good thing, but you have to have that support, because if you didn't, I can't imagine. I mean, I know a lot of colleagues elsewhere that they didn't have that support. And so public health can't be effective in terms of education and communications if you don't have that support to say, put it out there, put it out there. So
very much comes down to that communication aspect. I mean, it's very much like how you said early on, it's like public health, we have always been here. But the importance of it, I guess, has changed with you know, unfortunately, tragedies or things that happen in the world. But, you know, public health has always been here. Now people want to know more about public health, so we're pushing that now. Are there any interesting stories that have come your way, being recognized as a public health person? Or
I was at HEB one time, leaving my office, and I had my logo on my shirt, and
was it your logo or ours? Remember the vest we gave you?
Yeah, it was actually ours, because it was a cold day. So I had my coat on. It was a blue coat, so you can see it. And I was choosing my vegetables, and there was a man right there, and I needed an onion, and he was standing there, and I was sort of like, come on, I gotta pick up my onions. And so I guess he saw me a little bit impatient, and he looked over and he looked at my logo, and he's like, oh, so do you go out and inspect restaurants? I was like, I don't, but I have a team that does. And so if you want safe food, you got to trust public health. And so it was funny, because that's how he knew public health was that even after COVID, that was what he thought about, is the restaurants. And it's true. We go out and our teams go out to inspect and make sure that everything that helps us to make sure that there's a safe environment so people can enjoy their food at a restaurant. Have you been recognized in public?
Oh my
with
gosh,
all of your media appearances?
with how much you have not want to be on camera?
You know, that's funny, because I do get recognized. Actually, we went to a restaurant here in San Benito and walked in, and it's like, I see you on the news. And I was like, oh, jeez. I'm sure I turned red at that point. And she was with a group of people, and she yelled it so everyone in the restaurant just turns to look at me. It's a small restaurant, but still, I think there was maybe 25 people in there. And they just looked at me, and I just thought, oh my gosh, what am I going to? And I was like, yeah. She says, I seen the news. And of course, the other lady's like, why are you in the news? And I was just like, I said, well, I work for Cameron County Public Health. She's but why? And I'm like, because I'm the health director. And I had her shirt, I think, at that point. And so she was like, oh, okay. But of course, they were really nice about it. And I'm like, of course, my only question was, tell me I look better in person than I do on television. They're like, absolutely. I'm like, thank you. That's all I needed to hear. No, but I do. And actually, I do worry about that constantly. Even though I'm big on branding, you just never know what I might be doing, and people are going to turn around and make something big out of it.
Right. Yeah.
You know, I think when it comes to public health, sometimes I think this is where there's so much overlap that sometimes I feel like the Valley's just one big metropolis. It's going to be one big metropolis
for sure.
One day.
Yeah.
I'm pretty certain of it. And I think public health is going to have to merge at some point. But yeah, so do you want to talk about border health?
Actually, I think that's what attracted me to work here, is the binational aspect, bicultural aspect of working along the border, working in conjunction with Mexico on several things. But I think that's what really makes the strength of this region is we're able to collaborate and work with a whole other country where they might have different guidelines, they might have different resources, and we're able to come together and talk about the same problems that we're having. But I like working on the border and with a large population that speaks Spanish and English, where people live on one side, come to the other side to work or come to school and access services on both sides. Sometimes it's challenging. We lose patients, or they are lost to follow-up, or it can be a source of frustration to some of our teams when we're not able to carry out the work to the end. But I think it adds to the complexity that the environment that we're in.
Right.
Well, we treat patients on the Mexican side for TB, and I think that's getting somewhat to be a challenge because the numbers keep going up and the resources are not there.
Mm-hmm.
So from a binational standpoint, it's difficult to take care of the people, not only because we lose them, but also because the numbers are so high and we're just not able to keep up with the amount of work that needs to be done.
And and I think when it comes to border health and how we're so different from the rest of the state, I think what's fascinating is when Zika happened, it was one of those situations where people felt like, we're getting it from Mexico. People coming over here and giving it to us because we didn't have the mosquito here that was infected. So, so they're coming over here and it's exposing us. But then when we had the fungal meningitis outbreak, it's the opposite. Now people finally realized that, hey, I think it was an opportunity for people to realize that people go to Mexico for healthcare. We U.S. citizens go to Mexico, get healthcare. And that was for surgery. So imagine what they do for other kinds of illnesses that they tend to. And so we as Americans go to Mexico, get treatment, and come back here. And so we're constantly going to Mexico too. It's not just a one-way street. Yeah. It's a two-way street. And so that's just I think for me, that was good because I think that, again, for everything, I have to try to find the silver lining and everything. Otherwise I'd probably go crazy, right? And so I think that was a silver lining with that, was that people that were not public health could actually see the difference, and that it does have an impact in our communities. And so, to me, border health, it's pretty much, it has to be in our blood too to try to tackle it. We're not going to do it though. Obviously, unless we had a blank check, and even at that, I don't even know that we could, right? Because they handled everything so differently than what we do, and it's not that easy. Fungal meningitis luckily was a partnership, and a lot of people came together to figure out, okay, let's get to the bottom of it. Let's educate the public about it. These are the signs, symptoms to look out for, and so forth. And so, unfortunately, people died, because of this, this situation. And so we just hope that that's not what's going to happen for the next situation that is binational in nature. And so, but, it comes with our job in public health, and then being along the border, So yeah. I'm sure you have colleagues that obviously can't relate to some of this stuff because they're not on the border and their situations are different.
They're always like, oh, what's going on in Region 11? They seem to have everything.
You're welcome, right? Cameron County, we're just like, I don't know. I'm like, why is it that we had the first case of COVID? We had the first case of monkeypox, first Zika case. I'm like, and initially people are like, what's going on in Cameron County? But honestly, I think it's the relations that our epi team has with the hospitals. They communicate very, very, very well. I during COVID, it happened too, but everyone comes together. We all talk, we all communicate, we all get on the same phone line and let's talk about it. What's going on? What are the numbers? What are you looking at? And I think, and the communication with our EPIs, I think is what helps, that they're at that comfort level where they pick up the phone, doesn't matter what time, say, hey, I see this. The hospital infection prevention nurse can call our EPIs and, let's talk to the state. Let's talk about this case. And sure enough, it comes out to be something big. We're like, there's Cameron County again. And Dr. Pro was like, Esmer? I'm like, even if I played the lottery, I couldn't get this lucky, But,
for sure. Our brand of public health is very much for our community, and our community is very much based on people who come from two different places that are here in the United States and in Texas, and people who come from across the border. So that border relationship is very much a very important one.
Well, we did invite y'all here for Public Health Week, but I don't even think we even touched on Public Health Week.
No, we haven't.
But
we usually have activities just for our own staff.
Yeah.
So I know I'll be talking about the future of public health with Dr. Yamba. And they have several activities. I think our HIV STD team is going to be doing a info session. So last year we watched a movie, Old Yeller. Dr.
Contagion?
Tyler went.
Old Yeller?
Right?
About the dog?
The dog. Yeah. It's about rabies.
It's rabies.
And I was like, and then they had to
watch
kill
Cujo.
the dog. I didn't want to watch it.
Yes.
I only came to support him, but I didn't want to see a dog die. I was like, oh.
Well, it's bringing up dogs. That's a public health issue here, and
Absolutely.
it's been pretty popular conversation these days here in Cameron County. But yes, I mean, it's like that's an interesting thing about public health. I mean, why do we only have 1 week when it's every single day?
Exactly.
Yeah.
And
Do you all get a letter from Governor Abbott? We do.
a what?
A letter? A
For
sign?
what?
Oh, yes, a proclamation.
No,
No.
we didn't.
So I think,
Because we're
for
a
Public
state
Health Week?
agency.
Yes.
Mhm.
Oh no.
so I think that it brings up that when I first started working, and I there have been many conversations over the years about redoing that. There was a video that during my new employee orientation I had to sit through, and it was the title was Public Health is Everywhere. And it's old and antiquated. Somebody actually found a copy of it, and we saw it. The DRDs, the deputies, we have our own little subgroup that we get together, and we've been talking about the need to get this video updated so that people understand what we do, because we are everywhere. Public health is everywhere.
Yes.
And so maybe that's something that you'd like to take on as a challenge.
Absolutely.
And then with all
Challenge
the
accepted.
Yes.
Right?
so some of the things that we're going to focus on for public health is the mental health, reproductive and sexual health, emergency preparedness, healthy neighbors, but hopefully it's just 1 week out of the year. Like you said, it's every day, everywhere. And I think that's the message that we need to send out. We need to try to send out is that it's every day, everywhere.
There's a lot of people that don't understand the significance of public health, and, like it's been said before, and I always repeat it, but, in public health, we're victims of our own success. That, until something's wrong, then people remember us. But otherwise, if everything's fine, no one does, So, but I just think that I just don't want it to be taken for granted. That's the only thing. Like, you don't need to think about us, but just don't take it for granted, because we need to be in place in order to be able to do our job. And so,
Good chant. Ándale. La salud.
how do you say everywhere in Spanish?
Public health is everywhere.
I think we're going to recruit you to do our little...
I mean, whatever talent we can get, we're more than welcome to.
Yeah, you're pretty good at this.
Yeah. It's because she's a ham.
What's a ham?
A ham?
I'm not. That's Eddie Olivares.
No, a ham is somebody that really just is.
The ham radios?
No.
No, ham is an expression.
It's an expression to
Oh.
describe someone that's, just fun and, you're not afraid. You're not afraid of being embarrassed or people making fun of you or anything. You just, you're just yourself. That's
Real go-getter.
But Eddie Olivares, I keep thinking about him taking donuts. I'm like, what kind were they? Was he a Krispy Kreme guy or Shipley?
It was Shipley's.
I'm a Krispy Kreme
You're never
person.
Oh no, they put
never
too
gonna
much
let that down,
sugar.
huh? Yeah.
I know, maybe that's why I like it. No, but you know what? I feel like Krispy Kreme, Shipley's has too much dough.
Oh no, I like Shipley's way better.
I don't like
Totally.
donuts.
You know, I
H-E-B has
don't,
good
I don't
ones, too.
often eat donuts
I don't
either.
do
I don't
Donuts.
either,
Yeah.
but sometimes when I want one, it's like,
So
Isn't there a Shipley Donuts here?
yes, in Harlingen.
In Harlingen?
Mhm.
Yeah.
We don't have a Krispy Kreme, do we? No, it's a
No, I
Brownsville.
don't think so.
Or
Brownsville.
McAllen. So whenever you decide to come this way, be an Eddie Olivares and bring us donuts.
I know that you like Krispy Kreme now. Besides the
Yeah.
spuds.
Spuds and Krispy Kreme.
Super healthy
Spuds and
Public Health
Krispy
Week.
Kreme.
Yes.
And to tie it back into Public Health Week, just like Shipley's, we are everywhere. Oh my goodness.
Should we sing? or
Oh yeah.
something?
Yeah,
Oh,
yeah.
yes.
We should start the new outro song here now.
I'm
Yeah.
so glad we
Welcome
had this
home.
time together
Together.
just to have a laugh and sing a song.
Together.
That one's
Seems we
going
just
on.
got started, and before we know it, comes the time we have to say so long.
And that is going to be, from now on, we're going to use that clip for the end of all of our shows.
And on that note, thank you guys so much for joining us. Thank you very much to Dr. Pro and Ms. Hobbs, and of course to our Health Administrator, Ms. Esmeralda Guajardo, for joining us as well. Don't forget to follow us on our shows, on all of our social medias at CCPH Texas across all of our platforms. And of course, search for us at HealthYes on Spotify as well to stream that at your liking. I've been your host, Javier Ch. And remember, stay safe, stay healthy, and of course, stay educated. We'll see you guys in the next one. Bye-bye.
See, I told you it was going to be that complicated and hard.
I was nervous at the beginning.
I was too.
So you already started.
oh.
Actually, that was just practice.
When did you send us? When did you send us the invite?
Last week.
I've been having nightmares. No. That was way back.
Oh, when I told you back then.
Yes, I've been having nightmares since. Tonight I'll get a